Is the good life killing you? Are you dying for a double cheeseburger and fries? 70% of all deaths are now attributed to lifestyle choices. And thanks to obesity-related health issues, this will be the first generation to live shorter lives than their parents. We all know the solution. Move more, eat better. But we also know the power of bad habits. How do you change an entire lifetime of unhealthy choices? You can't do it alone, but there is help. CHIP is the lifeline you've been waiting for. You'll see a big difference in just 30 days. Heart disease, cancer, diabetes, high blood pressure. These diseases, virtually unknown 100 years ago, are now responsible for 3 out of 4 deaths. Today, obesity is the #1 health concern in North America. But our unhealthy lifestyle isn't just affecting adults. Obesity and its lifelong health consequences is now the top worry for children. But what hope is there for children if parents are settling for a life of medications, dialysis, angioplasties, and bypasses? Clearly, our indulgent Western lifestyle isn't working. But how can we change? You need to know lifestyle diseases aren't just preventable, they're largely reversible. And with the CHIP prescription for health, you can see changes in 30 days. Clogged arteries begin to open up. Blood pressures come down. Diabetes turns around. People eat more and weigh less. And high cholesterol levels drop more than 20%, and the extra pounds come off. How? By making safe, simple, painless, and deliberate lifestyle choices. It's all about your choices. CHIP gives you the education, motivation, and supportive community to make smarter choices. The CHIP program was founded by Dr. Hans Deal, director of the Lifestyle Medicine Institute. Along with esteemed researchers, Dr. Deal has shown that through simple lifestyle changes, many of today's killer diseases can be turned around. Now, he's taking that message around the world, liberating people from a life of obesity and disease. 50,000 CHIP graduates are living proof. CHIP works. The CHIP clinical results, based on before and after clinical and lifestyle evaluations, have been published in close to 20 medical journals, and medical professionals around the world are taking notice. And so are corporations. By bringing CHIP to their workers, progressive companies are reducing their medical costs and improving productivity.
I was on 7 pills and oxygen and 1 year to live. Since I found CHIP, I've lost 85 pounds, and I'm now living the best life ever.
In the CHIP program, you will be given attractive and easy-to-use program materials targeting important health and lifestyle issues. New behaviors are reinforced by the CHIP support team, our staff, alumni, and current members. The friends you make here are friends for life, in more ways than one.
These changes are much more powerful than medication.
Every community should know about the CHIP program and give it a try.
CHIP can help you get
the CHIP program began in 1986 with Dr. Hans Deal. And Dr. Hans Deal is an epidemiologist, which means he studies the causes of diseases, why they happen. And he then spent time at the Pritikin Life Center for Health, Mountain, California, with Dean Ornish. And after that, he got the idea that, not everybody can go to a life center like that. So he thought, well, what can we do to improve that? So he came up with this program where you can go into a community and you can bring 20, 50, 100, 500 people all together and teach these concepts of better lifestyle. And that's what he has done over those years. So today we have over 50,000 graduates around the world, and in particular in the Anderson area, in the Madison County area, we have helped over 1,000 people in the last 9 years of this program. We go into the community, we work through churches, we work through civic organizations, wherever we can go and get a group of people together. And when we get a group of people together, we then start our program. Our program will last for 4 weeks. And we do a blood draw at the beginning of the program, and then at the end we do another blood draw. The reason why we do a blood draw at the beginning, which gives us the lipid profile, the HDL, LDL, cholesterol, triglycerides, ratio, all these things, so that we have a baseline in which to begin. Then at the end of the program, we do another blood draw. so that people can see what can happen in a 4-week period of time. On the average, people will lose 7 pounds, and that's on the average. I've had some of my students lose as many as 25 pounds in 1 month. They will also see their cholesterol drop on the average 10 to 15% in 1 month. We have seen people who have dropped their blood pressure medications. Some of them have been taken off of 1 or 2 medications for blood pressure in 1 month. We have seen people with diabetes, which is another leading killer that I neglected to mention earlier. Diabetes, we've seen people reduce that, their insulin dependency, tremendously within a couple of weeks, and then some of them eventually taper down to almost nothing as far as medication on insulin. And all of this comes about because people are willing to listen to how our bodies respond to a lifestyle change. They understand that, and this program is scientifically based. This program is totally scientifically based. It's not what I think or the guy down the street thinks, but it's what science has proven. You see, Dr. Deal's research and all the people that go through it are part of an ongoing study, has been published in over 20 medical journals around the world. So people are looking at it and they're saying, hey, what is this all about? As a matter of fact, former President Bill Clinton has now embraced this lifestyle in his life and seen remarkable changes happen. Lost 20 pounds there for his daughter's wedding last year, and other things are happening, and his body is responding to this new way of lifestyle. When you sit down and you talk to people and they listen to what you say, many people can't hardly believe you because it just sounds too good to be true. But you see, we feel like we're on a mission. We're on a mission to help people to feel better and to not have to be dependent upon medications. And I'm not saying that medications has their place, but we want to show people how our bodies can respond to a very natural way of life, and they can increase their energy, they can increase their longevity, they can increase the quality of their life because of these things that are happening in their lifestyle, because they make some changes. And they will be able to feel so much better and be able to be more of a contributor to their family, their community, and their country, for that matter, because they feel better.
I didn't realize how much my daily routine had become harmful to my health. I knew my lifestyle demanded hard work. And with all the crazy hours I worked, I was constantly being on the run. My lifestyle slowly took a toll in December of 2004 when I was taken to the hospital.
Verna, you have cardiomyopathy. It's a deterioration of the heart muscle. We had to remove 21 pounds of fluid from around your heart, and currently you only have about 1/6 of your heart function. Verna, it's time to put your affairs in order. You don't have long to live. You may only have up to a year.
Well, Verna, we got your chest x-rays back. Looks like we're gonna need to start you on some oxygen at night, about 4 liters.
I found myself really sick. I got worse from day to day. I knew I was dying as I could feel the life ebbing out of me. I began making my funeral plans. I wrote love letters to my 6 children, my grandchildren, and my friends. The morning shower would leave me too exhausted to do much else. I would sleep away most days. I was desperate. I slept more than I was awake. I was putting on weight, and I was concerned about having a stroke. I just felt that there was no hope for me.
Well, I clearly remember the day I met Vern. She was distraught and discouraged regarding her health issues, and she was teary with frustration. She had shortness of breath, chest pain. She was 100 pounds overweight, was on 7 medications, oxygen at night, had sleep apnea, and clearly felt that she was dying and was desperate. I reviewed her chart carefully, and after speaking with her a bit, realized that we had some options. Despite her frustration, she was clearly motivated to live and live well. And I knew that her best and only chance for success was CHIP. CHIP is the Coronary Health Improvement Project.
As I relate to my patients over the years, I am so impressed that most people do not realize the power they have to create their own health. Power to prevent and arrest and even reverse disease. I also note in most people, it is never too late. The CHIP program motivates and educates people to make better day-to-day decisions about their lifestyle, what they eat and drink, how they exercise, and how they manage stress. We need to eat more foods as grown, fruits and vegetables, whole grains and beans. Over 50,000 graduates worldwide have lowered their blood pressure, blood sugar, cholesterol, and lost weight. They have overcome heartburn, chest pain, and depression. They have even reduced and eliminated many medications. CHIP graduates discover they have the power to preserve and renew their health.
When Verna arrived at my office 3 months later, she had graduated from the CHIP program. She arrived 35 pounds lighter, carrying a box of fruits and vegetables and crying tears of joy this time. She was clearly following CHIP, and she was exercising every day with no symptoms. At that point, we were able to start decreasing her medications.
I'm not dead. I'm very much alive. I'm almost 70 years old, and I lost 85 pounds. I just came back from a 50-mile bike ride. This last summer, I went 1,400 miles on my bike, and CHIP has given me my life back again. And I have so much energy, I just don't know what to do with it all.
You ever see anything like that?
No, it was definitely impressive. I
Wants information on where these programs are and where would they go for information?
We have probably the best thing, probably the best thing would be to contact my wife at this point, because we have several going on across the state right now. And her phone number is 765-621-7557. Give her a ring and we can let you know. I'll just share with you the programs coming up. Starting January 23, we'll have a program in Newcastle. Starting January 30th, we'll have a program in Anderson. Also January 23, we'll have a program in Marion. Starting then in March 20th, we'll have a program in Bloomington, down around the campus of Indiana University. And then the next month, starting, not the exact date yet set, but it'll be around April 20th, there'll be a program in Madison, down on the southern part of the state on the Ohio River.
Excellent. If